Your goal is to get the patient into a standing position, okay? You may have been working with the patient on sitting balance. You may have been working with the patient on weight shifting from side to side, working with the patient on scooting, and now you're ready to have the patient go into a full standing position. So typically, how would you think that you would assist the patient doing that? Okay, so we can assist coming to the edge of the chair. Okay, yeah, so the patient may want to just scoot forward like that, okay? Not the best way to do it, but we'll get into that. So then how would you assist the patient to come into standing?
Put their feet behind them.
Okay, and where would you be? How would you be assisting?
On the side of them.
On the side of them, so maybe hanging onto a gait belt or onto their clothes.
Right.
Under their arm on their affected side, right? Knee here. And then you're going to be saying, okay, ready, 1, 2, 3. Okay? Okay? Is that typically how you would see people do it? Okay.
Or we saw one of those lifty things that they had at the thing where they pump the thing up and the person comes up.
Yeah.
Those are pretty cool.
Yeah. Don't we wish they all had those at home?
I know.
We got problems. It is pretty much.
It's crazy.
Okay, so that's one way to do it, which I call kind of, lifting the patient to come up, which they're not really helping all that much. What are you thinking of when you're doing that? You're thinking, please don't let me fall, right? Okay. So let's think of sit to stand, facilitating them rather than lifting them up, okay? Now, all of you remember about posterior tilt and anterior tilt? So go ahead and sit on your seat for a minute and get yourself into an anterior tilt. Okay? And that's what we know for our sequence, that we need to have more of an anterior tilt than a posterior tilt when we go from sit to stand, right? Part of our normal sequence from sit to stand. Okay. The difficulty comes is that if our patient locks up into an anterior tilt, it's going to make it difficult to actually come into standing. What you really do is you get yourself into what we call a neutral pelvis. So I can assist and I can put her into a posterior tilt and an anterior tilt. But what I want to do is I want to get that neutral pelvis. And if you want, I have a picture in your lecture notes of your hand position to facilitate coming from sit to stand and getting that anterior tilt. You're going to notice that the little finger is in the abdominal area. There's a reason it's just the little finger there, because you don't want to give a lot of input into the abdominal area to get that neutral pelvis. You want to bring them up into an anterior tilt, then the little finger just relaxes them slightly. Could you see just that slight movement to unlock her from that locked position of an anterior tilt? That's what we want to do initially to get her to then assist her from sit to stand. Okay, so let's say that she is a right hemi. No, actually, let's make her left hemi so you can see a little bit easier my position. Now, she's got shoes on, so I can leave my shoes on too. If I had a patient who did not have their shoes on, or if I wanted to put my foot next to hers, I'm going to take my shoes off. Okay? So if she's against the back of the chair, let's do the preparation first. We need to prepare her. Okay? I can get my hand placement, which is going to be this. It's a little difficult hand placement to think of initially. Get my hand placement and bring her up into an anterior tilt, unlock her into that neutral pelvis. Then I can help her scoot side to side to come forward. So the first thing I'm going to have her do is to scoot with her good side, then scoot affected side, then scoot until she's at the edge of the chair. Now, I want to make sure that if I'm going to sit in my seat, that I'm not inhibiting her from coming up into standing, because we know she's got to lean forward, right? Patients will sometimes feel very comfortable having somebody in front of them, because then they are not as afraid of just falling forward onto the floor. So I'm going to have her place, not around my neck, but have her place her arms on my arms, okay? My position again, I've got her in an anterior tilt. I just, little movement backwards into her abdominals with my little finger. I have her lean forward, I lean back, and she comes into standing. Okay? Then going back down, we can just do the opposite and have her come down. Now, you're going to feel that with her hand placement, you're going to feel, is she putting weight on the affected side to come up? Is she just trying to stand up on her unaffected side? You're going to feel that through the pressure that she puts through onto your arms. Okay? Patients are going to have a tendency, if they just place their arms on your forearms, not to pull on you. If they put their arms around your neck, they're going to have a tendency to pull. You don't want them to pull, you want them to use their legs to come to standing. Okay? So sequence again, she's back like this. I need to get her into an anterior tilt. Okay? Unlock her just a little bit. Have her come forward. Okay, she's at the edge of the chair. And make sure that I'm not inhibiting her tibia from coming over her ankle. Get her again into an anterior tilt. Just a little bit of pressure on those abdominals to unlock it. She puts her arms up on my forearms. She leans forward and pushes up. Okay. And then you can sit her back down. So by